Aminoglycosides are a class of broad-spectrum antibiotics, primarily effective against aerobic gram-negative bacteria. They are often used in serious infections, particularly in combination with other antibiotics for enhanced efficacy. Aminoglycosides inhibit bacterial protein synthesis by binding to the 30S ribosomal subunit of the bacterial ribosome. In this video, we will discuss about some important clinical pearls about these aminoglycosides. So, let's get started. Number 1. Combination therapy. Aminoglycosides are often used in combination with beta-lactams or vancomycin for synergistic effects, especially in serious infections like endocarditis, or for broader coverage in severe infections. They are often used in combination with beta-lactams or vancomycin for synergistic effect in treating infective endocarditis. Number 2. Monitoring parameters. Regular monitoring of serum drug levels, like peak and trough levels, is essential to avoid toxicity and to ensure therapeutic efficacy. Dosing should be adjusted based on renal function and drug levels. Aminoglycosides should be avoided in patients with a history of hearing impairment or vestibular disorders due to the risk of ototoxicity. Number 3. Spectrum of activity. Aminoglycosides are primarily active against gram-negative bacteria and are often used in combination with other antibiotics for synergy. Streptomycin and amikacin can be used in the treatment of mycobacterial infections, such as drug-resistant TB disease. Amikacin is the most active against Pseudomonas compared to other aminoglycosides. Neomycin can be given orally to treat hepatic encephalopathy and before colorectal surgeries to act directly in intestinal bacterial flora and reduce the risk of infection after surgery. Number 4. Post-antibiotic effect. Aminoglycosides demonstrate concentration-dependent activity and exhibit a post-antibiotic effect where bacterial growth suppression continues after drug levels fall below the minimum inhibitory concentration. This allows for less frequent dosing of these antibiotics. Number 5. Ototoxicity and nephrotoxicity. Patients should be monitored for signs of hearing loss, dizziness, and renal function deterioration. Early detection of adverse effects can be helpful to mitigate severe outcomes. Aminoglycosides can also potentiate the effects of neuromuscular blockers, leading to increased risk of neuromuscular blockade. Number 6. Extended interval dosing. In certain infections, extended interval dosing, like once-daily dose, can be used to maximize efficacy while minimizing toxicity. This dosing strategy takes advantage of the aminoglycoside's concentration-dependent killing and post-antibiotic effect. In summary, aminoglycosides are potent antibiotics used for serious infections caused by aerobic gram-negative bacteria. Their efficacy is balanced by potential nephrotoxicity and ototoxicity, necessitating careful monitoring of drug levels and renal function. Combining them with other antibiotics can enhance their effectiveness, but careful consideration of potential drug interactions and contraindications is essential to optimize treatment outcomes. So, that's all for today. Thanks for watching. If you found this video helpful, let us know in the comments below which drug class you'd like to see clinical pearls on next. Keep learning, keep growing, and see you next time. Thank you.